Bappenas is stakeholder who has duty to coordinate and to coordinate with the among stakeholders. So we hope Bappenas can support on the social protection implementation in Indonesia. Now we coordinate with another stakeholder like Minister of Finance to talk about how the budget allocation, and for substance we should coordinate with another ministry like Ministry of Health and Ministry of the Employer.
In ensuring the Bappenas, the policymakers in Indonesia, to understand as well as to implement the social protection floor, we involve them since the beginning for the capacity building. We provide advocacy works by sharing what is the concepts, but also trying to identify what the policy and programs in the countries, including also the gap in terms of the policy and implementation. Based on that gap we identify, we develop the recommendation, and in the end, of course, the Bappenas has to buy in this program. And for example, in some cases, they actually earmark the program to ensure the sustainability of the program.
The Bappenas is helping us a lot with not only information, providing information, but also editing and the whole process, and it will be a joint publication with Bappenas. So that way we ensure that the relevant parties endorse the assessment. If your country is at least as big and diverse and rich as Indonesia, then the first step would be to identify, approach, and involve all the different line ministries, not only at the central level, but also at the decentralized level, because Indonesia is very much decentralized. Also the different UN agencies, international agencies involved, because not only that, these are the bodies that will provide us with the right information, but also these are the institutions that will make sure that the assessment doesn't stop there.
So I think it's important to involve all the stakeholders, relevant stakeholders involved from the beginning, but also trying to inline with their priorities, because they have the competing priorities, and by having this they can actually allocate the budget, but also move further with their own program.
So there's a lot of process in getting all the different stakeholders together, and I think that's the most, at one side, most challenging, and on the other hand also the most rewarding, because that way when you engage all the stakeholders, you know that their endorsement will help us get to achieve better social protection floor.
In Indonesia, for instance, our champion so far is Bappenas, which is the Ministry of Planning, and we are really in the last phase of the assessment. They really took the assessment as their baby as well, and so therefore they are doing this advocacy work with us, and it helps a lot.
That we have some challenge how to improve the institution of capacity, and we try to make it by cooperation with another stakeholder. The important issue is we should implement the universal health coverage. We hope that it will be implemented in 2014. So we now have some scheme of the social instrument for the formal sector, private sector, and the poor people. So we want to merge that scheme with the unified benefit and unified coverage.